Sports concussion. About your diagnosis. Common signs and symptoms you would see with a concussed child or teenager would be headache, nausea, vomiting, dizziness, balance problems, visual problems, fatigue or feeling tired, sensitivity to light, and numbness. Cognitive or mental symptoms would include feeling mentally foggy, feeling slowed down, difficulty remembering, and difficulty concentrating. Common signs and symptoms that may affect emotions or sleep would be irritability, sadness, more emotional than usual, nervousness, drowsiness, sleeping less or more than usual, and trouble falling asleep. Remember, you do not have to lose consciousness to have a concussion. The treatment for a concussion is rest. If you have a headache, you can usually take acetaminophen, which is brand name Tylenol. If you've had a concussion, always ask your doctor before you take any medicine. If it's suspected you've had a concussion, your doctor will advise against taking aspirin or ibuprofen, or any other NSAID for that matter. These medicines can increase the risk of bleeding. Returning to daily activities. Make sure to avoid physical activities and lengthy mental activities that require concentration. These include texting and video games. These activities worsen symptoms and prolong recovery. The injured person should not participate in any high-risk activities that may result in head injury until examined and cleared by a physician. This would include things like sports, PE, riding an ATV, or a bicycle. Make sure you get good sleep and take naps when you're tired. No late nights or sleepovers. When you're returning to school, inform the teachers, school nurse, counselor, and administrators about your child or teenager's injury and symptoms. School personnel should watch for signs of worsening symptoms. If symptoms are less severe, the school administrator can assist with your child returning to school by reducing their workload, giving rest breaks, and not giving standardized tests until symptom-free. This sounds nice, but you are not allowed to play sports until you are symptom-free. And remember, it's the law. Alabama concussion law mandates that the injured person may not return to any physical activities or sports until they are cleared by a physician. This means no PE class, sports practice, or games. When returning to play, you should follow a stepwise symptoms limited program with stages of progression. You should allow approximately 24 hours or longer for each stage and return to stage 1 if symptoms recur. Step 1 is rest until asymptomatic, no symptoms. After 24 hours, go to step 2, which is light aerobic exercise. Step 3 is sport-specific exercise. Step 4, non-contact training drills. Step 5, full contact training after medical clearance. Step 6 is return to competition, gameplay. Remember, when returning to school, you want to make sure that the student is easing back into their normal routine. If symptoms aren't severe, you can help by giving rest breaks for at least one per day or more if needed, reducing their workload and allowing flexibility with assignment due dates. Avoid loud noise and noisy environments and not giving standardized tests until symptom-free. As symptoms decrease, the extra supports can be removed slowly. Listed here is the list of educational links that have all the information that I have talked about so far today. Make sure to share it with coaches and teachers. When to seek emergency care. Symptoms such as headaches that worsen, seizures, neck pain, unusual behavior change, very drowsy, can't be awakened, repeated vomiting, slurred speech, significant instability, can't recognize people or places, weakness or numbness, and less responsive than usual.